Coronary Artery Disease, CAD, a comprehensive overview. Coronary artery disease, CAD, stands as the predominant form of heart disease and is a leading cause of mortality in the United States. Despite its alarming prevalence, proactive measures can significantly mitigate its impact. Understanding coronary artery disease. CAD, characterized by the accumulation of plaque in coronary arteries supplying blood to the heart muscle, evolves gradually. This plaque, primarily composed of cholesterol, fat, and other substances, hinders blood flow, elevating the risk of heart attack or failure over time. Prevalence. A staggering 18.2 million Americans, approximately 1 in 20 adults, grapple with CAD, making it the nation's most prevalent heart disease. In 2021 alone, 375,476 deaths resulted from CAD, with 20% occurring in individuals under 65. Forms of coronary artery disease, CAD. Coronary artery disease encompasses various conditions affecting the coronary arteries, each with distinct characteristics. Stable ischemic heart disease. In this form of CAD, blood and oxygen face increased resistance in reaching the heart, necessitating heightened effort. Management involves medications to reduce the heart's workload or surgical interventions. Acute coronary syndrome, ACS. ACS involves a sudden reduction in blood flow to the heart. Due to the potential for a heart attack, ACS is treated as an emergency. Severe chest pain is a common symptom, requiring immediate medical attention. Atherosclerotic coronary artery disease. Over time, a fatty substance called plaque accumulates in the arteries, hindering blood flow and elevating the risk of a heart attack or stroke. Causes of coronary artery disease, CAD. Coronary artery disease develops due to a combination of factors, often starting in childhood. Plaque buildup. Plaque, composed of cholesterol, fat, and other substances, adheres to blood vessel walls, leading to atherosclerosis. Over time, arteries become narrower and harder, impeding blood flow. Plaque rupture. Plaque may rupture, prompting the formation of blood clots as the body attempts to repair the artery. This process obstructs blood flow, causing myocardial ischemia, characterized by chest pain and shortness of breath. Risk factors. Various risk factors contribute to CAD, including high cholesterol, especially LDL or bad cholesterol, high blood pressure, smoking, diabetes, obesity, lack of exercise, stress, and genetic predisposition. Symptoms of coronary artery disease, CAD. Symptoms may vary, and some individuals may not exhibit noticeable signs in the early stages. Common symptoms include angina. The most prevalent symptom, angina manifests as chest discomfort during physical activity or stress. It may be mistaken for heartburn and can radiate to the arms, back, jaw, or shoulders. Shortness of breath. As plaque buildup restricts blood flow, inadequate oxygen supply to the heart may result in shortness of breath, particularly during exertion. Fatigue. Reduced blood flow can lead to fatigue, especially during physical activities, as the heart struggles to meet the body's demands. Symptoms in women. Women may experience atypical symptoms, including shortness of breath, extreme fatigue, nausea, vomiting, and back or jaw pain, in addition to chest discomfort. Risk factors. CAD susceptibility increases with age, family history, and certain risk factors. Common risk factors. High cholesterol, especially LDL, or bad cholesterol, and triglycerides. High blood pressure. Atherosclerosis. Smoking or vaping. Metabolic syndrome. Diabetes. Obesity. Lack of exercise. Stress, depression, and anger. Unhealthy diet. Excessive alcohol consumption. Sleep disorders, including sleep apnea. Gender-based risk. Men and individuals assigned male at birth face heightened risk after 45, while for women and those assigned female at birth, the risk rises after 55. Specific risk factors for women include eclampsia, preeclampsia, gestational diabetes, use of hormonal birth control, early menopause, and endometriosis. Disparities in coronary artery disease, CAD. Coronary artery disease exhibits notable disparities across demographic groups, influenced by various factors. Age and gender disparities. Men and individuals assigned male at birth face a higher CAD risk after age 45, while women and those assigned female at birth have an increased risk after age 55. Ethnic and racial disparities. Black, Hispanic, and Southeast Asian populations are more prone to CAD and experience higher mortality rates compared to other ethnic groups. American Indians are 1.5 times more likely to be diagnosed with CAD than white individuals. Socioeconomic and healthcare disparities. Disparities in income, access to quality healthcare, and systemic racism contribute to differential CAD outcomes. Black individuals, in particular, face higher rates of cardiovascular diseases. Diagnosis of coronary artery disease, CAD. Efficient diagnosis involves a combination of medical assessments and tests. Medical history and physical examination. Healthcare providers evaluate an individual's medical history, symptoms, and conduct a physical examination to assess overall health and potential risk factors for CAD. Electrocardiogram, EKG/ECG. This test measures the heart's electrical activity, identifying irregularities and assessing potential damage. It is a fundamental tool in diagnosing CAD. Stress test. Involving physical exertion, for example, treadmill exercise, or pharmacological stimulation. Stress tests evaluate the heart's response to stress, helping identify CAD-related abnormalities. Coronary artery disease tests. Tests play a crucial role in confirming CAD diagnosis and assessing its severity. Blood tests. Cholesterol levels. High levels of LDL, bad cholesterol and triglycerides contribute to plaque formation. High sensitivity CRP. Elevated levels may indicate inflammation, a CAD risk factor. Imaging tests. Computed tomography, CT, coronary angiogram. Provides detailed images of coronary arteries, aiding in plaque detection. Coronary calcium scan. Identifies calcified deposits in coronary arteries, assessing CAD risk. Functional tests. Echocardiogram, echo. Utilizes sound waves to evaluate blood flow and heart function. Exercise stress test. Monitors the heart's response to exertion, detecting CAD-related abnormalities. Nuclear stress test. Combines a stress test with a radioactive tracer to assess blood flow. Cardiac catheterization, angiogram. A more invasive procedure involving a catheter to inject contrast dye, allowing visualization of coronary arteries and identification of blockages. Coronary angiography. Utilizes X-rays and contrast dye to obtain detailed images of coronary arteries, aiding in diagnosis and treatment planning. Complications of coronary artery disease. CAD can lead to severe complications, including angina, heart failure, heart attack, and arrhythmias, emphasizing the critical need for proactive management. Treatment strategies for coronary artery disease, CAD. Managing coronary artery disease involves a comprehensive approach targeting risk factors, symptoms, and underlying causes. Treatment strategies aim to alleviate symptoms, prevent complications, and improve overall cardiovascular health. Medications. Aspirin and antiplatelet medications. Reduce blood clotting and lower the risk of heart attack. Statins. Lower cholesterol levels to prevent plaque buildup. Beta blockers. Control blood pressure and reduce strain on the heart. Angiotensin converting enzyme, ACE, inhibitors or angiotensin II receptor blockers, ARBs. Manage blood pressure and improve heart function. Nitroglycerin. Relieve chest pain by dilating coronary arteries. Lifestyle modifications. Healthy diet. Emphasize a diet rich in fruits, vegetables, whole grains, and lean proteins. Limit saturated fats, trans fats, sodium, and refined sugars. Regular exercise. Engage in aerobic exercises and strength training as per medical advice to enhance cardiovascular fitness. Smoking cessation. Quitting smoking is crucial for reducing CAD risk and improving overall health. Weight management. Maintain a healthy weight through a combination of diet and exercise. Invasive procedures. Angioplasty and stent placement. Involves widening narrowed arteries using a balloon, angioplasty, and placing a stent to keep the artery open. Coronary artery bypass grafting, CABG. Redirects blood flow around blocked arteries using blood vessels from other parts of the body. Atherectomy. Removes plaque from arteries, improving blood flow. Cardiac rehabilitation. Structured exercise programs. Tailored to individual needs, these programs aid recovery and promote heart health. Education and counseling. Provide information on lifestyle changes, medications, and coping strategies. Medical procedures and devices. Implantable cardioverter defibrillator, ICD. Monitors heart rhythm and delivers shocks to correct irregularities. Pacemaker. Regulates heart rate by sending electrical impulses. Enhanced external counterpulsation, EECP. Improves blood flow by using inflatable cuffs on the legs. Treatment of comorbid conditions. Manage conditions like diabetes, hypertension, and high cholesterol to address contributing factors. Coordinate care with specialists to ensure a holistic approach to health. Psychosocial support. Offer emotional support and counseling to address the psychological impact of CAD. Encourage stress-reducing activities such as meditation and relaxation techniques. Regular follow-up and monitoring. Periodic medical checkups to assess treatment efficacy, adjust medications, and address emerging concerns. Continuous monitoring of risk factors to prevent disease progression. Collaborative care. Engage healthcare providers, specialists, and the individual in shared decision-making. Foster a collaborative approach to address individual needs and preferences. Medications for coronary artery disease, CAD. Effective management of coronary artery disease often involves the use of medications to address various aspects of the condition. Medications aim to control risk factors, alleviate symptoms, and prevent complications. The choice of medication depends on the individual's specific health profile and the severity of the disease. Aspirin and antiplatelet medications. Aspirin reduces the risk of blood clots by inhibiting platelet aggregation. It is commonly prescribed to prevent heart attacks in individuals with CAD. Statins. Atorvastatin, Lipitor, Simvastatin, Rosuvastatin. Lower cholesterol levels by inhibiting the production of cholesterol in the liver. They help prevent the progression of atherosclerosis and reduce the risk of heart attacks. Beta blockers. Metoprolol, atenolol, propranolol. Control blood pressure, reduce the heart rate, and decrease the workload on the heart. Beta blockers are beneficial in managing angina, preventing arrhythmias, and improving overall heart function. Angiotensin converting enzyme, ACE, inhibitors. Enalapril, lisinopril, ramipril. Dilate blood vessels, reduce blood pressure, and decrease the strain on the heart. ACE inhibitors are often prescribed to manage hypertension and improve heart function in CAD patients. Angiotensin II receptor blockers, ARBs. Losartan, valsartan, irbesartan. Similar to ACE inhibitors, ARBs relax blood vessels and lower blood pressure. They are an alternative for individuals who may not tolerate ACE inhibitors. Nitroglycerin. Sublingual nitroglycerin, nitroglycerin patch. Relieve chest pain, angina, by dilating coronary arteries, improving blood flow to the heart. Antiplatelet agents. Clopidogrel, Plavix, ticagrelor, prasugrel. Reduce the risk of blood clots and are often used in conjunction with aspirin, especially after procedures like stent placement. Calcium channel blockers. Amlodipine, diltiazem, verapamil. Dilate coronary arteries, reduce blood pressure, and decrease the workload on the heart. They are prescribed for angina relief and blood pressure control. Nitrates. Isosorbide dinitrate, isosorbide mononitrate. Relax blood vessels, alleviate chest pain, angina, and improve blood flow to the heart. Antiarrhythmic medications. Amiodarone, propafenone, sotalol. Stabilize heart rhythm, especially in individuals prone to arrhythmias associated with CAD. Diuretics. Furosemide, hydrochlorothiazide. Help manage fluid retention and reduce blood pressure by increasing urine output. Anti-ischemic medications. Ranolazine. Reduces angina symptoms by improving blood flow to the heart without significantly affecting heart rate or blood pressure. Invasive procedures for coronary artery disease, CAD. In cases where medications and lifestyle changes are insufficient, invasive procedures may be recommended to address coronary artery disease. Angioplasty and stent placement. Procedure. A catheter with a balloon is inserted into the narrowed coronary artery. The balloon is inflated to widen the artery, and a stent, mesh tube, may be placed to keep the artery open. Purpose. Improves blood flow by eliminating or reducing blockages in the coronary arteries. Coronary artery bypass grafting, CABG. Procedure. Involves grafting a healthy blood vessel from another part of the body, often the leg, onto the coronary artery beyond the blockage, creating a bypass to improve blood flow. Purpose. Redirects blood flow around severe blockages, particularly when multiple arteries are affected. Atherectomy. Procedure. Involves the removal of plaque from the coronary arteries using a catheter with a rotating blade or laser. Purpose: opens narrowed arteries and enhances blood flow. Enhanced external counterpulsation, EECP. Procedure: inflatable cuffs are wrapped around the legs, and they inflate and deflate between heartbeats, increasing blood flow to the heart. Purpose: improves blood supply to the heart muscle and may be considered for individuals who are not candidates for other interventions. Cardiac rehabilitation. Cardiac rehabilitation is a structured program designed to support individuals with heart conditions, including those with CAD. Exercise training. Supervised aerobic and strength training exercises tailored to the individual's capacity. Helps improve cardiovascular fitness, stamina, and overall physical health. Cardiac risk factor management. Education on lifestyle modifications, including diet, exercise, and smoking cessation. Guidance on medication adherence and management of comorbid conditions. Heart health education. Information on understanding CAD, its risk factors, and strategies for prevention. Empowerment to make informed decisions about heart health. Nutritional guidance. Dietary counseling to promote heart-healthy eating habits. Emphasis on a balanced diet, low in saturated fats, cholesterol, and sodium. Emotional support. Counseling and support to address the emotional and psychological aspects of living with CAD. Stress management techniques and coping strategies. Lifestyle changes for CAD management. Healthy diet. Emphasize a diet rich in fruits, vegetables, whole grains, and lean proteins. Limit saturated fats, trans fats, sodium, and refined sugars. Regular exercise. Engage in aerobic exercises, for example, walking, swimming, and strength training. Aim for at least 150 minutes of moderate intensity exercise per week. Smoking cessation. Quit smoking to reduce the risk of CAD and improve overall cardiovascular health. Weight management. Maintain a healthy weight through a combination of diet and exercise. Consult with healthcare providers for personalized weight management plans. Stress reduction. Incorporate stress-reducing activities such as meditation, yoga, or hobbies. Manage stress to support overall heart health. Limit alcohol intake. Moderate alcohol consumption, if allowed by a healthcare provider, with awareness of individual limits. Regular medical checkups. Attend regular follow-up appointments for ongoing monitoring and adjustment of treatment plans. Communicate openly with healthcare providers about any concerns or changes in symptoms. Prevention of coronary artery disease. Prevention strategies involve risk awareness, regular health checkups, weight management, avoidance of smoking and secondhand smoke, limited alcohol intake, smart dietary choices, regular exercise, and stress mitigation. Outlook and prognosis. While CAD lacks a cure, prognosis hinges on age, symptoms, health conditions, and risk factors. Lifestyle modifications and adherence to prescribed treatments can positively impact outcomes. When to seek medical attention. Regular checkups, symptom monitoring, and prompt reporting of changes or medication-related concerns to healthcare providers are crucial. Immediate medical attention is imperative for symptoms indicative of a heart attack or stroke. Conclusion. Coronary artery disease's multifaceted nature necessitates a holistic approach to understanding, prevention, and management. By integrating medical advancements, proactive diagnostics, and comprehensive lifestyle adjustments, individuals can empower themselves against the pervasive threat of CAD. Always consult healthcare professionals for personalized guidance and interventions. Your health matters. Quali.health